allows us to improve healthcare, to improve the outcomes for patients. And I see this every day with the new immunotherapies that are being developed, which have only come about through intense research. The new diagnostic equipment, the new pathology tests, the new way of aggregating data, which our researchers are developing, and of course the new approach to individuals being able to control their own health record. I say new, but my health record started 6 years ago. We already have 6 million Australians, but what's really important here is that we're giving every Australian the opportunity to be part of a system which will give them control over their own health data for the very first time. And that's an immensely important step forward. And in 5 and 10 years' time, I think this will be seen as a critical step forward. All of this feeds into the 4 pillars of our long-term national health plan. Firstly, giving people access to the best primary care in the world, access to our doctors, our nurses, and our medicines. In terms of our doctors, what we've been able to do is to come together to make an agreement with the AMA and the College of GPs, which has ended the issue in relation to the Medicare freeze, but most importantly, engage them on data, engage them in being involved with the MBS review, and we're working with them on additional primary care models over and above what's already in place, which will allow them to work with groups of patients to get better health outcomes for their people. All of this is linked to what we're doing with our rural health strategy. And there, 3,000 new doctors and 3,000 new nurses into rural Australia, but with incentives. And that will help patients, and that will help doctors, and that will help nurses. Our medicine story is amazing. Since coming into government, we've listed over 1,700 medicines. We've added more than $7 billion of new medicines to the PBS. But these are medicines such as Kisqali for breast cancer. And we've seen Opdivo for head and neck cancer. We have new immunotherapies such as Keytruda. We're dealing with so many different conditions, whether it's spinal muscular atrophy, critical things where new medicines are coming on board, such as Spinraza. In our hospitals, we've struck an agreement to reduce the pressures on private health insurance and delivered the lowest changes in 17 years, and I'm very confident we can go lower still this year. That's about supporting our private hospitals and in turn supporting our public hospitals, where we've had a 50% increase in overall investment since the 2012-13 last full financial year under the previous government. And then that brings me to mental health. This is one of the 4 pillars, along with preventive health, of the long-term plan. The investment in suicide prevention, protecting our older Australians, and the Million Minds Mental Health Mission, a 10-year, $125 million mission. But it's not about the money. It's about the longevity of research and the data that will produce. Finally, I want to address the issue of medical research, which is at the heart, in many ways, of what you're doing and what you're driving, and I want to thank you and acknowledge you for that. The Medical Research Future Fund will see a doubling of medical research, and it's about applied research, clinical trials with $250 million, investigator-led frontier science programs and clinical research. We have translation, which is so critical, and health data and health systems will benefit from what you're doing. And then lastly, the missions as part of the Medical Research Future Fund. The brain cancer mission, the Million Minds mission, and the genomics mission, which will also last for a decade and will help, I think, lead the most significant transformation in Australian medical treatment in the last 50 years. You are the front line. I want to thank you and acknowledge you and wish you a tremendous ARCS conference for 2018.